So hi, my name is Christiana Condra and I'm a HACC nursing student. I got chosen today for my assessments, the peripheral, vascular, and the lungs and thorax assessment. So first I'm going to begin by doing wipes. So I'm going to wash my hands. I'm going to introduce myself to the patient. Hi, my name is Christiana Condra. I'm a HACC nursing student. Can you please state your name and date of birth?
Irene Conjar, 5/23/1970.
And do you have any allergies?
I do not.
And next I'm going to provide privacy for the patient by closing a curtain or shutting a door. Next, I'm going to tell the patient what I'm evaluating. Is it okay if I do a peripheral, vascular, and lungs and thorax assessment today?
Yes.
And I'm also providing safety for the patient and myself by doing proper hand hygiene, wearing gloves when needed, cleaning the stethoscope to reduce all types of infection, microorganisms, and disease. So first, what I'm going to do for the peripheral vascular is look at her upper and lower extremities. And as I note here, they do look symmetrical. I don't see any lesions, any abnormalities or deformities. I don't see any ecthymosis, which is a reddish tint, or erythema, which is a bruising. And I don't notice any cyanosis, which is a bluish tint. So next, what I'm going to do is check the skin temperature, and I'm checking with the back of my hands. And it is warm to the touch, which is a normal finding. And she has no atrophy or hypertrophy. She has normal muscle tone. So next, what I'm going to do is check her skin turgor. So I'm going to lift this up, and that is elastic and resilient. So that is normal. I'm going to check her capillary refill. So I'm going to squeeze her finger, spring it back, and that came back in 3 seconds. So that is brisk, and that is a normal finding. So next, what I am going to do is have her, is going to check all her different areas. So first I'm going to check her temporal pulses, and that is a +2 equal bilateral. Next is her carotids, and that is a +2 equal bilateral. Next is going to be her brachials, which are also a +2 equal bilateral. I checked her apical beforehand. That was 66. That was strong rhythm, and that was equal. Next, what I'm going to do is check her radials, which when I checked it beforehand, that was at 62. And that is equal bilateral +3. So next, what I am also going to do is check for any edema or swelling also before I begin on her lower extremities. And as I am palpating around her foot and her ankles, I don't notice any swelling or any pitting, which would be graded on a 1 to +4 scale. So there is no pitting or edema. Next, I'm going to have her lay down, and I am going to check her popliteal pulse. So I'm going to bend her feet up, and as I notice, that is a +1, and also a +1 on this side, and that is equal bilateral. Next is going to be the posterior tibial pulses, which is right here. And that is +1 equal bilateral. And then also her dorsalis pedis on each side, which is equal bilateral +1. So now what I am going to do is I am going to grab my stethoscope, which I am going to clean. And you have to make sure that you clean it between each patient. Before I assess her temporal and her carotid pulses for any bruits, I am going to check her epitrochlear nodes, and they are non-palpable, which shows that they are normal. And I don't see any masses or lesions or any abnormalities when I am looking around. And then you would also check her inguinal nodes, which are located right here. So next, what I'm going to do is turn the bell on my stethoscope and have her sit up if she is able to herself. And I'm going to turn it on the bell side, and I'm going to check her temporals, which is +2 equal bilateral, and then her carotids, which are +2 equal bilateral. So next I'm also going to check for her jugular vein distension, which she needs to lay down for that. She has to be at a 30 or 45 degree angle. I'm going to have her put her chin to her chest on each side, and I don't see any jugular distension or any abnormalities there. So now what I'm going to have her do for the lungs and thorax assessment is first I'm going to wash my hands, and I'm going to have her take a seat in the chair. And I'm going to begin by looking at the size and shape of her chest wall and the symmetry. I'm going to look at her apices on each side. So I'm going to have her cross her hand, making sure I don't look at any of the breast tissue. And I'm looking at her apices, which should be across the transverse plane, a 2-to-1 ratio. And they are symmetrical and bilateral on each side. Her skin tone is normal. It is tan with some pink undertones. I checked her her respirations beforehand. They were 13. They were deep and they were regular rhythm. There was no strain in that. And I'm going to now check for any clubbing. So I'm going to have her put together her fingers. And I see a small diamond, so she has no signs of clubbing. So now what I'm going to do is look for any signs of distress. I don't notice any signs of distress. Her posture is erect. She has no difference in her posture. She is using no accessory muscles such as her shoulders or her chest. She has no nasal flaring. She also is conscious, alert, and awake. She has no cyanosis, which is a bluish tint, which would show low oxygen concentration. And she is alert. She knows what we are doing. So what we are going to begin by is palpating around her chest and asking if she feels any tenderness and if I feel any masses or crepitus, any lesions or anything like that. And do you have any tenderness? So she has no tenderness, which is good. So now I'm going to do a test called tactophrenitis. So I'm going to have her stand up and turn. And what I am going to do here is put the edges of my hands across the posterior chest, and I'm going to have her say 99,
99, 99, 99.
And as I go down, the vibrations diminish, which is a normal finding. So now I'm going to have her sit down, and what I'm going to do is clean my stethoscope, grab an alcohol swab, which you want to do between each thing for each patient to reduce the spread of infection. And I am going to use my diaphragm. So I'm going to start at her tracheal bronchial, and I'm going to have her take a deep breath in and out. And here I note that expiration is longer than inspiration. So next I'm going to look at her bronchial vesicular, which is on each side of her sternum. So I'm going to have her take a deep breath in and out. And here I notice that inspiration is equal to expiration. And you can hear some of the lung tissue here, also with some of the bronchi and bronchial sounds. So next I'm going to take a look at her vesicular, and I'm going to have her take a deep breath in and out, and another deep breath in and out. And here I notice that inspiration is greater than expiration. So on females, you would also check her vesicular underneath her axilla because of her breast tissue. On males, it is usually done on the chest. So I'm going to use the left side as her control because there's only 2 lobes over there to make room for the heart. So I'm going to have her take a deep breath in and out. And as I notice here, her inspiration is longer than her expiration. I'm going to have her do it on the other side. Take a deep breath in and out for me. And that is equal bilateral regular rhythm on each side. So now I'm going to have her stand up. Now I'm going to have her turn to the back. And how you check her posterior lungs is you are going to make sure you don't do it along the spine or the scapulas. and you do it as many times as how long her torso is, because you don't want any part of the abdomen involved. So I'm going to have her take a deep breath in and out, and another one. And these are bronchial vesicular sounds because I can hear some of the bronchi along with some of the lung tissue and bronchioles. And then the third one, breathe in and out, and again. And those are your vesicular sounds, and I don't want to go any further down. So I don't hear any lifts, thrills, or heaves, or any friction rub or anything like that, any abnormalities, any wheezes. So now what I'm going to have her do is sit down, and I am going to ask her if she has a cough. So do you have a cough today?
A slight cough.
Would you say it is dry or moist?
Dry.
And is there any color to it?
No.
Is there any, so there's no kind of clear color?
Clear.
So it is clear. Have any odor to it?
No.
And is there a consistency? Would you say it's thick or thin?
Thin.
And then is there any?
It's not real big either. It's like small.
So you would say the size is small. So is it usually like in a tissue?
Yes.
Okay. And that is the end of my assessment. Thank you.